Hi, everybody. Welcome to the Culpeper Chamber of Commerce Town Hall on COVID-19 vaccinations. We're joined by Novant Health, UVA Health System, Culpeper Medical Center representatives, representatives from Fauquier Health, representatives from Virginia Department of Health, Rappahannock Rapidan Health District, and Culpeper Emergency Services. Today's informative session is to let people know where we are in the process of the COVID-19 vaccinations, to let people know just how safe this is and how this is going to help our community. I'd like to introduce Donna Staten, the CEO, President of Novant Health, UVA Health System, Culpeper Medical Center. Donna, thank you for joining us today and tell us a little bit more about what we're going to be chatting about.
Great, thank you, Jeff, so much. So we have a panel of speakers today that we're going to focus on really what we've been up to for the last several weeks within our community, how we've been planning furiously behind the scenes to get the vaccine rolled out across our health district, and what we've been able to accomplish so far just in the last couple of weeks. So we have a series of speakers, as I mentioned. We're going to cover a variety of topics, including Dr. Hassan with our emergency department services. We also have Dr. Karchner and April Octor with our health department, and then Bill Uten with our local Culpeper emergency services, to be able to bring some different perspectives to the table around vaccine preparedness and efforts across our health district and communities. So as a Culpeper Medical Center, we've been working on vaccinations for our internal facing staff since before Christmas. I'm happy to share that all team members that elected to receive the vaccine have received both first and second doses of the vaccine. We also began partnering with our local health district and health department to begin vaccinating other phase 1A, which is essentially frontline healthcare personnel. And right after the holiday season. Last week alone, we partnered with our local Culpeper County Public School System and vaccinated over 800 school system employees, as well as a number of community members. So lots of effort has been underway and strong partnerships with community stakeholders. As we look forward, all of our work will continue to move forward in partnership with our local health district. As vaccine supply is limited to some extent, like anything, supply and demand, like we saw in the early phases of COVID, we ran into some challenges with personal protective equipment and just making sure that our supply chain was being pushed out in a regular basis. We're seeing similar effects with the COVID vaccine supply. So this is really allowing us to partner closely with our health department and local emergency services to make sure that we're able to get that vaccine out. So I'm going to pause there and turn it over to Dr. Hassan, but Jeff, is it back to you and then to Dr. Hassan?
Yes, I'll go ahead and introduce Dr. Hassan. Dr. Neil Hassan is the Director of Emergency Department at Culpeper Medical Center. And I also want to take this moment to thank everybody who is joining us and remind you, if you have questions, please type them in the chat function, and we will have a Q&A session once we are through all of our presentations to ask some questions. We've already had a few emailed to me, so I have those prepared. But now we'll go to Dr. Neil Hassan, Director of Emergency Department at Culpeper Medical Center. Dr. Hassan?
Thanks, Jeff. Appreciate it. I'm just going to go over some kind of big picture items regarding the facts around COVID. To let you know about myself, I'm a practicing emergency physician for over 20 years. I've been on the front lines taking care of patients, including during COVID. Just to give people a big idea of what's going on with COVID, believe it or not, in 2020, COVID was the leading cause of death in the United States. It beat heart disease, it beat stroke, it beat diabetes, it beat cancer, it beat everything. The #1 killer in America. To get an idea of how bad this disease is, 1 in 13 Americans have been infected with COVID so far, 1 in 13. These are dramatic numbers. Of the 100 million cases worldwide of COVID, 25 million are in the United States. So that means we're 0.4% of the whole world's population, but we have 25% of the world's COVID cases. So it has definitely hit the United States the hardest. To give you some perspective, you hear all these numbers being thrown around. I want to compare it to the flu so people have an idea of influenza versus COVID. In the 2019-2020 flu season, there were 34,000 deaths out of 35 million cases. That's a 0.1% mortality, 0.1% from flu in 2019. COVID, we have had 425,000 deaths out of 25 million cases. That's a 1.7% mortality. And just to make numbers very rough, you're talking about 17 times more deadly than flu last year, as COVID has been in broad strokes. You can look at different numbers across different counties and different regions that might affect that number, but you're looking at an order of magnitude more deadly, 10 to 20 times more deadly than the flu. Very serious illness. In 1 week in January, we had more deaths due to COVID than the entire deaths due to flu in 2019 to 2020, in just 1 week in January of 2021. So it gives you an idea of how deadly this disease is. I'm giving you all these numbers because I want all of you to know we've taken care of many COVID patients in our community, many sick COVID patients. Our hospital has been nearly full with COVID patients at times. We've had frontline emergency department and hospital and critical care workers and support staff who have been taking care of these patients since March with no vaccine up until about a month ago, and essentially nobody got sick. And the reason why is because of safety precautions. Things you can do today to affect the chance that you'll get COVID: wearing a mask, social distancing, avoiding large groups, good ventilation, remaining outdoors. All of these things really matter. You can ask any frontline emergency worker, would they ever go in and not wear a mask? And they would say absolutely not, because the masks are what makes a difference. I joke with friends of mine who aren't sure if masks really work, and I say, well, next time you go to have surgery, if your appendix ruptures, you can tell your surgeon, don't bother wearing a mask. To give you an idea of why masks are effective, they block disease. I'll go over a little bit about the vaccination that's available, and then I'll hand it over to Dr. Karchner. Just to give you some broad strokes on the US population, the number of people in the US that are over 16 years old, meaning they're eligible for the vaccine, is about 250 million people. The best that we're doing right now with the 2 vaccines we have from Pfizer and Moderna is somewhere on the order of 10 to 15 million doses produced per week. So you extrapolate that over 250 million people, and we've only, by the way, vaccinated a very small percentage of our total population. You're looking at anywhere from 15 to 20 weeks possibly of waiting to get vaccinations, get enough of the population vaccinated to achieve herd immunity. So I'm telling people that just because that's the reality of how long it's going to take to get all these people vaccinated, and why, most importantly today, what you can do are the basic precautions like wearing a mask. And I'll hand it back to you, Jeff.
Thank you, Dr. Heston. That was very informative, and I greatly appreciate it. We will now go to Dr. Wade Karchner with the Virginia Department of Health, Rappahannock Rapidan Health District. That's a mouthful. Just want to welcome you, Dr. Karchner, for being here today, and to be able to share a little bit more about the vaccination process. Dr. Karchner, thank you so much for being here.
Thank you. And as an aside, that's why we refer to it as the Rap Health District. It makes it a lot easier for everybody. Now, we've been deeply involved with the rollout of vaccine for months now. And initially, the 2 hospital systems in our district, Fauquier Health and the Culpeper Medical Center, were vaccinating, as Donna said, their frontline staff. And the health district set up a central location at the Riva Fire Department with outreach to the Phase 1A folks as well that were not associated with the health system. We quickly outgrew that location, and we've since moved to the Germanna Community College Daniel Technology Center in Culpeper as our central location. And as you know, we were ready to open to Phase 1B workers and the 75 plus group about 2 weeks ago, when the categories were abruptly broadened to include 65 and over and anybody 18 to 64 with medical conditions, while at the same time the supply of vaccine coming to Virginia was severely constricted. This has placed a strain on everyone, and we now have thousands of people in the queue on our 1B workers list, and we have tens of thousands on our greater than 65 and those with medical conditions list. We're working through these lists as fast as we can, with the main barrier being the vaccine availability. We expect to receive approximately 2,000 doses a week for the next 4 to 8 weeks. We are working to allocate those doses equitably throughout the health district. We're using some at our central clinic at Germanna, and we are reallocating some doses to our partners. This includes the hospital systems, this includes private clinics and pharmacies. We're working with our community partners to get vaccines into as many arms as soon as we can. I would say that our capability far exceeds the availability at this point in time. With the many partners that we have that are ready and willing, if we got more vaccine, we could certainly vaccinate a lot more people very quickly. I would mention to please visit rrhd.org to sign up and get on the list by filling out a survey for the vaccine. For those without internet access, they can dial 540-308-6072. You will likely need to leave us a message, but we will get back to you. And in closing, I just would like to say, please be patient. We will get through this shortage together, but it will take time. Thank you.
Thank you, Dr. Karcher. And I think that patience is something that's a great point to make, because that's what we're hearing a lot of is when can we get it? When can we get it? And as you mentioned, there's a lot of factors that go into that. And so we will now go to Fauquier Health and Sarah Cubbage. And Sarah, you're going to share a little bit more about how Fauquier Health has handled it. And you have some great information from one of your doctors. Sarah, thank you for joining us today.
Absolutely. Jeff, can you hear me okay?
Yeah.
Okay, perfect. So good afternoon, everyone. I just really want to take a moment to just, first of all, say thank you for including us on today's call. I know that we have done a couple of virtual town hall presentations over the last couple of weeks, and the information is just changing at such a rapid pace. So it's really important to be able to, get this education and this information out to the community. So I am Fauquier Health's Public Information Officer, and I've been working very closely with our dedicated COVID-19 vaccination team here internally. Just kind of want to share a few takeaways with the group. Over the last month, we have been working around the clock in collaboration with our local and state community partners. So we've been working with Fauquier County government, the town of Warrington. We've also been in close contact with Fauquier County Department of Fire Rescue and Emergency Management, as well as obviously Rappahannock Health District with VH, to make sure that we are really having a smooth vaccination rollout process. Ultimately, what I wanted to share with you is that our first priority is to really make sure the communities are working kind of collaboratively together. The biggest thing is that by having more access points to give residents and community members the vaccines, the better. Somebody kind of explained this to me the other day, just to kind of put things into perspective. When you have a popular concert, the concert goers show up to the gates to enter in. You have multiple gates, multiple access points to keep those lines moving. Otherwise, if you just have one gate open, it's not going to be an ideal situation. So, we were excited earlier this week. We hosted our first community vaccination clinic on Monday. We had the opportunity to vaccinate almost 405 individuals, as well as we are having another one tomorrow. Again, that ultimately is directed and based on vaccine availability, which is crucial at this time. But really, that's kind of our short-term solution right now. The long-term solution would be eventually to get the vaccines more broadly available in local physician and office clinics. So as your healthcare providers, we really are going to be working, around the clock with us to help support EDH and any way that we can to help get that vaccine administration out. So I just kind of wanted to share that. And really, I think before I pass the mic back over, we actually got a really good presentation that we have put together with our infectious disease doctor, Dr. Tam Lee. She's with our physician services practice. So I would like to go ahead and just share her words that she shared with us. It's got some good takeaways. Ideally, she kind of touches on the vaccine, the benefits, her own experience as a medical provider getting it. So I'm going to go ahead and share my screen so you can see that. Give me one moment. Okay. Go ahead and play this.
just wanted to reiterate the importance of us considering getting the vaccine for COVID-19. The vaccine is safe and effective. So for those who are still concerned about the vaccine, I would urge you to look at the data and the studies. Please do not look at social media to guide you in your decision-making process. The vaccine is made up of really 4 components. So it's sugar, salt, the mRNA, and the lipid transport media. That's about it. Okay, there's no preservatives in there. It's a dead vaccine. So it's a very safe vaccine. When you look at the data from the 2 large trials that have been done, the Pfizer and the Moderna trials, they are independent trials, but they use the same modality. They use the same technology in creating the vaccine, so the mRNA. When you look at the 2 studies, the results mirror each other at 95% efficacy. The side effect profile is similar between the 2 studies. So again, hopefully that'll help with your confidence in getting the vaccine. So on the one side, we have these 2 large studies that are showing really good efficacy and safety data. On the other hand, right now, we have a raging global pandemic with increasing cases locally and nationwide. So a lot of you work with me at the front line. You see what I see at the bedside. So this viral infection can cause a lot of harm. We know it can cause a lot of complications. Our patients come in and they can't breathe. Some of them require intubation and mechanical ventilation. And when they get on that ventilator, you know that these patients take a long time to get off of that ventilator. And some of our patients, unfortunately, have succumbed to this infection. We also know that there are long-term complications from getting this infection with lung scarring, POTS, and a lot of other cardiac complications. So it hurts me every time I see a patient admitted to the hospital with this infection. I don't want anyone here on this call to get this infection, and getting this vaccine is one of the ways that we can prevent this from happening. I'll end with this. I received my vaccine and I am doing fine. I feel fine. I am anticipating the minor side effects that can come with it, but so far I feel normal. Even if I do develop any of these side effects, I know that my immune system is revving up and responding to the vaccine, which is a good thing. And I believe in the science. Our field is deeply rooted in science. I believe in my colleagues who have worked diligently to get us this vaccine, to protect us, and to try to end this pandemic and save lives. So I hope all of you will think about the vaccine carefully and protect yourself from this ongoing disease and pandemic as we try to end it.
So that was a quick presentation, and I hope that that information was helpful. I know one of the biggest takeaways in that presentation that really seemed to help was just kind of addressing the simple components that's actually in the vaccine, just to kind of reiterate for those folks who have concerns about allergic reactions. The vaccine really is comprised of some simple components, so it's effective. And with that being said, that kind of does it for me. So I appreciate, again, you guys giving me the opportunity to present that and kind of share a couple of words about what we've been doing here. And I'm going to go ahead and kick it back over to you, Jeff.
Thank you so much. I appreciate you sharing that information, Sarah. It was great information, and we appreciate Dr. Lee joining us and being able to share from her video. So greatly appreciate that. Next, we'll go to Bill Uten with Culpeper Emergency Services. And Bill, you are one of the ones who have had your vaccine already, and you share a little bit about what that process is like and how you're feeling.
Great. Can you hear me okay?
Yep.
All right. Fantastic. Thank you, Jeff. Yes, I have received the vaccine, and I can say that I had very, very mild side effects, mostly just a little lethargic. Within 24 hours of me receiving the first dose of that, I was a little bit tired, went to bed a little early, and that was pretty much it. So And that's been pretty much mirrored with my staff here as well. All of my staff that wanted to get the vaccine has been offered, have received that vaccine. And I'm hearing similar reports from them that the side effects are very minor, very mild, nothing severe at all. So again, it's a very safe vaccine. We have every confidence in the science behind this now. And I'd like to take the opportunity again to mirror some of the comments of my colleagues here on this call, that this is a marathon, not a sprint. It is going to take some time. We hear this every day, and we understand the anxiety and the people waiting in the anticipation for getting this vaccine. We get it. But like Dr. Karchner's talked about, there is a somewhat limited supply that we're receiving in the health district. Everybody here, in this room, I can tell you, in speaking to that behind the scenes collaborative effort has been phenomenal. We have spent weeks and months now just, working with each other into the wee hours of the morning, oftentimes, developing programs, protocols, whatever it is that we can do from a local level to help our citizens. And that collaborative effort has been phenomenal and fantastic, and I appreciate that. And then again, also to again spread that message that, while we go through this process and while we, wait, everybody waits to get this vaccine and we get through those phases, we can't again stress the importance enough of the preventative measures of wearing the mask, washing your hands, keeping that social distance. We've been doing this now for quite some time. We need to continue to do it for a little while longer until we can get through this process. There is a light at the end of the tunnel. It's certainly there. We're getting there. Please, everyone, be patient. There's a lot of folks, a lot of boots on the ground working to get this done. And they're doing everything that they can.
Thank you, Bill. Greatly appreciate it.
Thank you.
And thank you for everything you and the first responders are doing in the community. We recognize it, and it is making a difference. So thank you so much.
Thank you, Jeff.
And now we will go to some questions. We had some that were sent in earlier, and this is for all the panelists. Mostly, I think, Dr. Karchner. This comes from Liz Walters with Bingham and Taylor. Their question is probably similar to many other employers in town. As an employer of essential manufacturing workers, they've submitted their survey to the Rappahannock-Rapidan Health District requesting vaccinations for employees. Is there any updates on which phase the region is in currently, or what the timelines are?
We are currently in phase 1B, but there are tiers within phase 1B, and we're slowly working through those tiers as well. And like I said, we have thousands of people that fall into that phase 1B tier, and we're working through those as quickly as we can.
Thank you very much. We received a couple different versions of this question, but essentially it's all the same. What conditions or what other diseases should not receive the vaccine? We had somebody in Q&A ask about they have MS. Will the vaccine trigger a relapse? Other folks that have conditions. Is there concerns, or what can you advise?
I can take that one. According to the official CDC recommendations, the people with underlying medical conditions, and it doesn't parse out which ones, it just says underlying medical conditions can receive these vaccines provided that they have not had an immediate or severe allergic reaction to a COVID-19 vaccine or any of the ingredients in the vaccine. That's it. There are really no other conditions that would disqualify one from receiving the vaccine.
Another question, folks have crossed county lines to get the vaccine. Is that allowed? Donna, would you like to answer that one?
Sure, I'm happy to. So, it becomes a race to the finish line in terms of where you can get the vaccine first. We are really trying to keep our allocations within our health district. I think that's very, very important to do, as allocations are right now being pushed out based on population size. So while there may be opportunities, I think if you live in a separate county, but you work in the county that the vaccine is being offered, that is an acceptable crossing of county lines, if you will. But for those residents that live within the health district, that's where we're trying to make sure that our vaccine supply is allocated to that population. April, I don't know if you want to weigh in additionally from the health department or not.
Sure. So I agree with you, Donna. We are absolutely trying to keep folks within their county borders, but we know that this is a limited resource. And sometimes when our partners and districts do things a little differently, opportunities come up in other areas. It also has come to our attention. We've had a lot of comments come in that they're concerned about the group 1B and how folks are getting in the queue, and that maybe someone has jumped the line when others are more in need. And just to reiterate, Dr. Karchner, there is a list even within phase 1B where we go down and police and fire were number 1, corrections number 2, and teachers number 3. And we're sending invitations right now mostly through that teaching group, and then we'll move on to the other groups. We know we've had a couple of people who fell through the cracks, even with our staff being so diligent to look through the surveys and the list and try to take anyone out that doesn't meet criteria, and shame on them for that. We are all doing the best we can. We will work through these lists with our limited allocations and get vaccine in arms as soon as we can.
Thank you, April. One of the other questions we had was the number of vaccines, and Dr. Karchner, April, you might be able to answer this one. The number of vaccines the health district has, does that include the second dose, or is that a separate number?
The answer to that question is in flux. Usually what we've been given is that first doses are shipped separately from second doses. So when I mentioned that approximately 2,000 doses are coming each week, those are all first doses. They are also shipping to us on the back end second doses. But currently that 2,000 number is first doses.
Thank you, Dr. Karchner. One of the questions that came in our chat was, one of the questions on the vaccine questionnaire asks if you were on a blood thinner. Can you get the vaccine if the answer is yes?
Yes, you can get the vaccine on a blood thinner. There's no interaction to worry about.
Dr. Hassan, let me also ask, as somebody who has a severe nut allergy, that's one of the things that we've heard a lot of. If you have a severe allergy that allows you to go in anaphylactic shock, what is the protocol for that? Is it safe to get?
Absolutely. Safe to get with all latex, nut, other food allergies. There's only, as Dr. Lee said, those few components in the vaccine. And that's why we still have, just as an extra precaution, we have watched people for 15 to 30 minutes after a vaccination, should they need any kind of intervention like an EpiPen. But we haven't seen any side effects with peanut allergies.
We've talked a lot about our community partnerships here. I see a few other groups that are asking. Ellen Phipps from Aging Together is asking, how can they get my information? Donna, what's the best way for folks to be able to get this information that we are sharing, and how can they help spread it out to their entities?
So I think that 2 things. Number 1 is we're trying to create one central source of truth in the community, so that there's not confusion, and that is directing community members to the Rappahannock-Rapidan Health District website. And so we are working very closely with all of our partners on that to make sure that we are directing any questions, and we are getting lots of questions from community members. So that's where we are pointing them, as well as to the number that Dr. Karchner shared earlier. I would also add that I think we're trying to put together in partnership with Fauquier Health kind of an info sheet that is a 1-pager that we would be able to share out with our community partners and follow up to today's conversation. So we'll make sure that we push that out through the chamber, and we can get that into the hands of our community partners as well.
Thank you, Donna. Dr. Karshner and April, this question is probably for you. This is coming from Josh Gully with the Culpeper Times. How many total first doses have been administered in the health district? How many second doses? And how long does the vaccine remain effective before another shot is needed?
So I have the number on first doses for you. I don't know that I have it on second. So it looks like we've given 4,021 first doses, and that's just within the health district. That of course doesn't include the doses that have gone out through the hospitals. We'll have to work on getting the second dose number for you. We just started those this week. And what was your other question?
How long does the vaccine remain effective before another shot is needed?
So that is still being studied, and I'll defer to Dr. Karcher or Dr. Hassan if they have additional information, but the studies and the trials are so new that it's going to take time for us to follow folks over a longer period and determine how long and when they may need a boost. That may also be influenced because viruses change. As they replicate, they don't make exact copies of themselves. And as we're seeing these new strains originate in other places, there may be changes based on that as well.
And kind of, I think it goes along with that question. After somebody receives the first vaccine, are they automatically registered to receive the second vaccine, or do they have to register again?
So in our system, they are not automatically registered. The system that we're using right now is called VAMS. I think we may switch over soon to the system the hospital is using. So we, when it gets closer to their time, what happens is we open a clinic and the patient gets an email reminder that it's time for their second dose and the clinic has been opened.
And I think for those community members that are receiving the hospital vaccine, we are using the same approach for consistency. They will receive an email with the email address that they registered for their initial first dose with the reminder of the day of the clinic that we are offering for their second dose for them to go ahead and register to return.
And just something to tell all of our residents is they don't need to fill out a second survey to receive a second dose.
Along those same lines in the time frame, if you get the first dose, must you get the second dose within a certain time frame? And if you don't, do you start all over again?
So the recommendations are dependent on the type of vaccine you receive. And if you get Pfizer, there's a 21-day interval, and Moderna is a 28. These are minimum intervals. The CDC has a recommendation that you can go up to 42 days before you get your second dose, but really there is no maximum interval. So there is a minimum. They don't want you getting it before the 21 or 28, but there's no maximum. And even if you go over that 42-day mark, you do not need to restart the series.
Thank you, April. And somebody was asking, can you still get sick once you are vaccinated, or are you immune? Would it be safe to visit family once vaccinated if there's an infant that they would be returning home to?
I think the best way to address this is that we still need to follow all the precautions that we're following now that Dr. Hassan mentioned earlier, until we have an idea as a society and a population of how many people actually are immune from their vaccination. So I think the same caveats still apply, even after you've had your vaccine. So the answer to that question would be that. And can you get sick once you're vaccinated? In general, just following the vaccination? Absolutely, because even if you do become immune from the vaccination, there still is approximately a 2-week lag as your body works up and develops those antibodies. So you could become exposed just before or even after your vaccination and still come down with COVID-19 before the immunization, even the first one, has a chance to develop antibodies.
And Jeff, I'll echo what Bill Uten said about this being a marathon. You know, viruses want to survive too. They're going to fight back in essence and try to get better and smarter. And so we have to continue to be the same way. So we have to just gather data going forward. I will say a lot of folks who don't want the flu vaccine, for instance, say, I don't get the flu vaccine because it makes me feel sick. It's not you're getting sick, it's that you're having the appropriate immune response. I'm mentioning that because I've noticed a lot of folks, the second dose of the vaccine, you might have a little bit more of the side effects. They still last about a day, but that lets you know that it's working. You're not getting sick, you're not getting COVID. But the second dose, more commonly, you might feel some side effects.
And Dr. Hassan, while we have you here, the question in the Q&A is, do two people who have the vaccine need to wear a mask when in the room together?
If they've both been vaccinated and it's been some period of time since the vaccine, as Dr. Karchner mentioned, for your immune system to rev up, I would say the risk is relatively small, but because the vaccine is mutating, because we don't have a lot of data going forward, there are new strains out there, I would still exercise an abundance of caution, just because getting infected with maybe a variant strain that might be immune or strong against the vaccine, you don't want to risk getting COVID-19. And I can tell you from the front line, you do not want to get this infection. So wearing a mask is a small inconvenience. That's all it is.
So folks that have already had the virus, are they able to get the vaccine?
Absolutely. We, of course, want them to be well. And so we don't want anyone coming to get a vaccination if they are under isolation or quarantine. The recommendation right now is that if you have been sick with COVID, you can wait 90 days. Honestly, that's more of a supply issue. We expect those that have been sick with COVID to have some immunity for that 90-day period. But it's not a contraindication. And so even if you've been sick with COVID, we do recommend that you get your vaccine.
Wonderful, thank you. I think there's some great questions out there. A lot of people are, as we're seeing, that folks are calling and asking, when can we get the vaccine? It's more a when, not an if. So we're excited to see that. We want to thank everybody for being able to share your insight and your knowledge. And I want to thank all of our panelists, Donna Staten from Culpeper Medical Center, Dr. Neil Hessen from Culpeper Medical Center, Dr. Wade Karchner and April Actor from Rappahannock Rapidan Health District, Sarah Cubbage from Fauquier Health, and Bill Uten from Culpeper Emergency Services. I want to thank you all for joining us here today. And it looks like we have one more question. So if you do have a question, please type it in the Q&A. We have a couple more minutes, but I just want to thank everybody that joined us as a panelist. And it looks like there's a question here. Is there updated data on how soon symptoms will appear?
From the vaccine or from illness?
I think that is reference to the illness.
So when we talk about investigating a disease that is communicable, we look at the incubation period of the organism. And so if you have an exposure to COVID, most patients are developing symptoms between 5 to 7 days after that exposure.
Awesome. Thank you so much. And unless there's any other closing thoughts, I will say thank you, and everybody stay safe, stay healthy, and wear your masks.